Well, we're joined now, I'm pleased to say, by Professor Nicola Ranger, who is the General Secretary and Chief Executive of the Royal College of Nursing. Great to have you on. The first time I've interviewed you, so thank you for being on Sky News today. Just talk us through what's happened, what you've rejected, or the nurses, I should say, have rejected the pay deal.
Yes, thank you very much for the opportunity to be here. We asked our nursing staff what they felt and what they thought about their pay. And they've come back in record numbers, over 145,000 responded, to say actually, for all the challenges in nursing and that nursing is facing, it just isn't enough to actually make a difference to themselves, the patients and the NHS as a whole.
Is this partly because nurses have seen what junior doctors have managed to get and thought, hang on a minute, this isn't enough?
I think our nursing staff recognised that the junior doctors, their pay award was hard fought. They went on strike 11 times to get that pay award, and we wouldn't remotely begrudge them that. However, we absolutely recognise the government's assessment of the NHS. Many nursing staff that I've spoken to recently and generally recognise that whatever sector we look at in the NHS, it's not providing the care that it needs. So what they want is where pay conditions actually makes a seismic difference for themselves and the NHS.
I was interested where you say that the junior doctors' pay deal was hard fought and that they went on strike a lot of times. Is that what nurses are prepared to do as well? Are you prepared to strike in order to get the pay deal that you think is right?
At this moment in time, we don't want to go on strike. We just want to be listened to, taken seriously. And what our nursing staff have told us is that it isn't enough, but we want to be part of the solution, and that's where we want to go. What we
doesn't sound like you're ruling it out, though.
We can never fully rule that out, but as a first start, what we want is to be part of the solution. Nursing staff believe in the NHS. They want it to work. They recognise it's failing for patients, and actually they want to be part of the solution. But to do that, whether it's community, whether it's mental health or acute care, nursing has to be at the centre. And we've got too many structural problems that need sorting out, of which pay is part of that.
And if you don't get the pay that you want, I understand that you hope the government comes back and says, yep, no problem, we'll give you a pay rise. If you don't, striking is on the table for nurses.
At this moment in time, we don't want it to be. It is always something that we have in our toolkit, but what we really want to do, we know that patients have had enough at the moment. The satisfaction in the NHS is the lowest in its history. We do want to be part of that solution. We've got a new government. I've written to the Secretary of State with suggestions around what we want to get things better. At this moment, what I've heard loud and clear from nurses across England and the rest of the UK is we want to be seen as part of the solution. But with the vacancies we have, the huge number, the drop in of people going into the profession and the huge numbers of nurses leaving, something has to change, and we need change.
Can I talk to you about the timing of this announcement? Because the press release dropped. I mean, I was sitting in this seat. The press release dropped just as Rachel Reeves, the Chancellor, was giving her first speech as Chancellor, just as she was talking about securing a deal with public sector public sector workers. You dropped the bombshell. I mean, that was deliberately timed, wasn't it, to cause maximum embarrassment?
That wasn't our intention. We finished our pay ballot on Friday. We let both the government and the Treasury know a week ago that we will be announcing the outcome of our ballot today. So it was not trying to cause maximum damage.
Come on, I wasn't born yesterday. It's not just a magic coincidence that it happened just as she was there. You wanted to, maybe maximum embarrassment is the words, not the words you chose, but that was a deliberate timing, right?
It wasn't a deliberate timing, but we did feel when so many nurses have spoken out around their pay, they do want change. They do want things to be different.
It was a magical coincidence, was it? That it was just as the Chancellor was speaking.
Genuinely it was. However, we'd always planned for to release this out to our members today because they needed to hear the outcome of their ballot, with it closing on Friday. Look, we want to be part of this solution. We do recognise that the government has been really clear and we agree with the state of the NHS. And all we want to do is start those negotiations, to start being able to say, what can we do to get things better for nursing? Because whatever the government want to do, without nursing at the centre, it's going to be extremely difficult.
Can I talk to you a bit more widely about what you make of the government's first few months in office? Because I think it's probably fair to say that some other union leaders have been, I guess, quite frustrated with what they see as a potential return to austerity. Obviously, the government would dispute that language, but they're worried. They don't feel like this is a Labour government that so far is committed to delivering for workers. What's your own view?
I actually applaud the fact that with Lord Darcy, West Streeting has given what we feel is a fair diagnosis of what's going on within the NHS. Many nursing staff recognise what's in that report with regard to the care that is currently being delivered. So actually, I think we want to do things better. Many nursing staff have worked under a Labour government in the past. Although the Royal College of Nursing is not politically affiliated, we do remember when satisfaction for the NHS was at 70%, when diagnostic pathway meant something, when waiting times meant something. And actually, it is really quite shocking. You know, I've been out and about looking at the experience of patients. It is shocking to be in a corridor for hours and hours upon end. It's shocking to have patients that are potentially having a stroke sitting in a chair for hours on end, extra beds on wards in front of fire escapes. And actually, I think we recognise the shocking state of things. So we do think the government has been right to highlight that. And what nurses want to do is be part of that solution.
Some of our viewers might be listening to this now thinking, you're saying that the state of the NHS is shocking. If nurses go on strike, that's only going to make the patient experience even worse.
And I completely agree with that. That's why we are reluctant at this moment to be threatening strike action. What we want is proper, genuine dialogue with this government and with West Streeting to say, what can we do together to make a seismic change to sort out the real challenges for nursing staff in this country. We have to recruit and retain brilliant nursing staff. And at the moment, there is not enough seismic change to make a big impact for themselves, their patients, or the NHS. That's what we want.
OK, thank you very much indeed. Good to have you on the programme today.